Good afternoon. So far in this course, we've talked about healthcare provider duty to patients. We've talked about various types and sources and the basis of liability. For these next two classes or next 2 weeks, we're going to talk about quality and how we maintain quality in our healthcare delivery system. So for this first week on quality, we're going to look at regulatory, licensure, and accreditation controls on our healthcare delivery entities and providers. This is the more traditional type of quality imposed by licensure and regulatory bodies. And then next week, we will focus on some of the new quality controls that are coming with greater technology and more involvement by the consumer. So for the first thing, let's look at hospitals and other healthcare facilities. They're very heavily regulated, and there's some traditional mechanisms for ensuring quality. Why do we need to do that? When you and I need to go into a hospital, well, do we pick hospital A, hospital B? How do we know that this is, a good place to go for, our healthcare or for our family's healthcare? How do we know when we're like referring somebody to a physician? Do they, is this a good physician? How do we make sure that we know those types of things? Well, one way is through external controls: state licensure, private accreditation, and certification for Medicare and Medicaid. So the first thing let's look at is hospital licensure laws. This is a state-by-state authorized process. There will be an authorized agency in that state. For example, in Texas, it's the Texas Department of State Health Services that will be responsible for governing the hospital licensing law. There will be a licensure application process for the healthcare facility, and there's different processes for hospitals, for acute care hospitals, for specialty hospitals, such as rehabilitation hospitals or mental health hospitals. And there will be a different process for other types of facilities that are not hospitals, but that are, for example, nursing homes, long-term care facilities, facilities such as that. So there'll be specific requirements. And if we're looking at just the hospital licensing laws, and we're just going to take that as a good example for some of the regulation for all different types of facilities, but look at hospital licensure specifically. There are numerous requirements. There will be requirements related to building and architectural requirements, fire safety. I mean, they get down to, how many inches wide does a fire safety door have to be? How thick does the fire safety door have to be? What is the top of the walls that meet the ceiling? What are their specifications and requirements? What's behind the walls? They have to meet very strict fire safety codes. Sanitation requirements, what processes are in the hospital? What are the, flooring materials? What are the wall materials made out of? All types of sanitation requirements to make sure that environmental safety can be maintained. Workplace safety, in addition to OSHA, there's going to be all types of requirements for workplace safety and for monitoring the health and safety and making sure that employees are not subjected to injury unnecessarily, and to try to minimize and mitigate that if all possible. There'll be staffing requirements for both physicians and how your physician staffing should be. There's got to be a chief medical officer over a hospital, and then various other requirements of physicians depending on what services that hospital offers. There will be staffing requirements for nurses depending on how many units, how many beds are you licensed for, and hospitals will be licensed for a certain number of beds. Those beds may be general floor beds, and the nurse ratio per patient on those floors will be different than the nurse ratio per patient in an intensive care unit. So all types of staffing requirements are built into the hospital licensure law. Services for patients, what services do you offer? Do you offer labor and delivery for obstetrical patients? If so, there's going to be all kinds of requirements on what are the requirements for your labor and delivery unit, for your postpartum unit, and so forth. And there'll be patient transfer requirements. We've already talked some about patient transfer laws and how that impacts facility to facility, and that one of the things that's often required would be a patient transfer agreement between facilities. So for example, the Texas hospital licensure law, there's a requirement for hospitals to have patient transfer agreements, and then there's also a requirement for a patient transfer policy to be in each facility. The licensing agency will adopt and enforce rules in addition to the statute or the law enacted by the state's legislature. Then the licensing agency, whatever agency is determined to be that's going to be the one governing and carrying this out, they will also adopt and enforce numerous rules to carry out the hospital licensing law and to govern the specific operations of the facility, the management of the facility, survey, like when are the state surveyors going to come in? They're going to come in before the facility ever opens. They'll come in periodically, probably every 2 years or so after the opening of the facility. They may come in more often if there's complaints against the facility and so forth. They will govern relicensure of the facility, and whenever an application has to be upgraded or the various requirements that the facility has to go through for relicensure and how often that's done. Designations such as a trauma designation is this, designated as a level 1 trauma center, which is the highest that will, take trauma patients directly from the scene of an accident. Whether you do neonatal care and what the designation is for neonatal care, maternal care, etc. There's also private accreditation. In addition to this very lengthy and very specific licensure process, many hospitals will go through private accreditation. One of the most common ones and ones that we're all most familiar with is the Joint Commission. There are several others, but the Joint Commission is what we will again use as our example of private accreditation. The private accreditation bodies will set standards. They will have standard books, and there will be hundreds, if not thousands, of standards in that book for accreditation. They will do on-site surveys. Again, before the hospital gets accredited, there will be an initial survey or an initial accreditation survey before the accreditation is ever awarded. And then periodically, likely at least every 2 years after, unless it's more often due to complaints or problems that are noted with the facility, they will come in and do an entire survey. This generally takes several days. There will be multiple surveyors that show up at the institution, and they work with administration, they will work with employees, various departments. They do everything from crawling around in the ceiling, with your fire safety officer to look at sprinkler system requirements, to, sitting down with members of the medical staff to look at their medical staff credentialing processes, on to looking at if you have clinic settings, going into the clinics and looking to see what their processes are, their documentation requirements. They'll talk to your nurses, they'll talk to your environmental service people. They look to see if you have boxes sitting on the floor versus up off the floor like they're supposed to be. There's generally a big piece of the accreditation or the state survey for that matter that deals with infection control and how your infection control processes are set out for the facility. They will evaluate your compliance with the accreditation standards and verify improvement opportunities that the hospital may have. It's a very complex and an ongoing process. It's not just a one and done. You will repeatedly get surveys and have to provide information. Again, patients can complain or employees can file a complaint with the accreditation body just like they can with the state licensure office. And if they do that, that may prompt an on-site survey. It may just prompt an inquiry saying, provide us information on this event and so forth. But it's fairly strict monitoring, both on the accreditation side and on the licensure side. So why go through private accreditation? It's not a requirement for licensure. You can get licensed by the state authority and open your doors as a hospital. So why do many hospitals go through the accreditation process? Well, the rationale for that is that it elevates the hospital in the public's eye. So that if I'm a patient or you're a patient and we're looking to say, where are we going to go to the hospital if we get sick? Where am I going to take my family members? What hospital do I want to go to? In addition to, community, standards and just information and word in the community on what hospitals, provide what services and what level they do it at. Obviously, hospitals advertise, but one thing that patients may look at is this an accredited hospital? And hospitals will advertise or set out in materials that they are an accredited or a Joint Commission accredited hospital. It shows the hospital's commission to excellence. It shows that they maintain certain standards and that they have a compliance with certain regulatory standards, that they are implementing standards to improve care and looking at patient safety and quality standards. And an important reason is that it's recognized by CMS, the Centers for Medicare and Medicaid Services, for Medicare and Medicaid payment. So a huge reason to go through the private accreditation. So let's talk next about certification for Medicare and Medicaid. It is federal, it's not state. So it's not state by state. CMS is a federal authorized agency that governs Medicare and Medicaid participation and involvement. It's mandated by the Social Security Act that there are certifications or conditions for participation that each healthcare facility that receives Medicare or Medicaid payments, which virtually all do, that they have certain conditions of participation. Hospitals have conditions of participation. Long-term care facilities will have a different set of conditions for participation. And one thing that's important on the accreditation side is that CMS will deem Joint Commission accredited hospitals as meeting CMS conditions for participation, because CMS can also come in and do a survey, and most facilities would prefer that they have the state survey process or the accreditation process. The CMS process is, I guess, a frightening often, or at least it's a very challenging situation for a facility, because CMS can remove the hospital's right to be involved in or participate in Medicare and Medicaid, and hospitals get millions and millions of federal dollars through those programs. So there are overlapping regulatory controls, and those do lead to problems. Some of the problems that we see is jurisdiction. Is this a state licensure issue? Is this a private accreditation issue? Is this a CMS issue? And CMS and the state can always overrule and say, hey, we get it. You may have private accreditation, but we are authorized and we are tasked with the responsibility of making sure that our hospitals, our healthcare facilities are, in compliance and providing the care that we think is needed and necessary from a quality standpoint and a necessity standpoint. So their standards may be similar, but not exactly the same. So you're subject to surveys by multiple bodies. And even if you have a state or a private accreditation survey, CMS can still come in and do a survey as well. If you have an accreditation survey, the state can also come in and do a survey as well. Patients may not, if they want to file a complaint or if they have questions, they may be confused about, do I go to the state for this? Do I go to the accreditation body for this? Do I go to CMS for this? So, just some confusion in who's controlling what. And there is some overlapping regulatory control. Again, the standards are similar, but not exactly the same. And it's a very costly process. I mean, hospitals spend hundreds of thousands of dollars a year across the nation to meet licensure and CMS requirements and to get accredited by a private accrediting body. Hospitals will have employees, depending on the size of the hospital. They may have an entire team of employees who are survey readiness employees. Their job essentially is to, like on a daily basis, work throughout their hospital or their hospital system to make sure that there's compliance with the standards that are set out by these licensure certifying and accrediting bodies. So that is a very typical way that hospital licensure and accreditation works. There's very similar types of laws and rules that apply to nursing homes, hospices, ambulatory surgery centers. Virtually every healthcare facility is going to have licensure, specific licensure requirements and specific standards that they have to comply with. For example, in a question that I was asked during the COVID-19 response was, who can be a testing center? Is it only hospitals that can be testing centers? And you know, the question was, well, it's going to need to be someone who's authorized by the state where that facility is located to provide this care, because it is a patient care or patient service. So there were laws during the COVID response that loosened up who could do that, and it included pharmacists. And that's when we started seeing some private, you know, national chain pharmacies. I think Walgreens was one of them that opened up testing centers. So it wasn't just hospitals or physician offices at that point, but also pharmacies could open up testing centers in addition to our public health facilities like our local public health authorities and so forth. So those are traditional mechanisms that the state and the federal government has in place to make sure that our healthcare facilities are meeting certain standards, that they're licensed, they're authorized, and they are, you know, safe places to open their doors and hold themselves out as providing healthcare for patients who may need their services. So that's the information on our traditional regulatory licensure and accreditation requirements. And then in next week's class, we will look at some of the advances, if you will, in quality control measures that are over and above these. But for now, for hospital regulatory, we'll look at that. We're going to move on in our next video to talk about professional licensure.